Have you ever been to a rave or a music festival and wondered what everyone was on? Well, they were most likely on Molly, which is a derivative of ecstasy, and it seems to be the new party drug. The term Molly refers to MDMA in powder or crystalline form. Majority of the time, Molly is taken in powder form, which is put into a capsule which people swallow. Molly tends to induce feelings of euphoria, feelings of intimacy, and can even eliminate one's anxiety. Taking Molly can have both long-term and short-term effects on a person. Many people may ask, what exactly is Molly and why are we just hearing about it now? Molly, which is short for molecule, is considered to be pure MDMA, unlike ecstasy, which is usually coated with another substance such as caffeine. The Drug Enforcement Administration, commonly referred to as the DEA, considers Molly to be a Schedule I controlled substance, which means that it is illegal. Since Molly is a Schedule I controlled substance, that means that it is a high potential for abuse and that there is no accepted use in medical treatment. Due to the low cost of Molly and its wide availability, the amount of people using it is rising at a rapid pace. Many music artists are also speaking about Molly and singing about Molly in their songs, making their fans and listeners more aware of the drug and possibly wanting to try it themselves. Just this past month at Ultra Music Festival in Miami, Madonna was quoted as asking the crowd how many people in the crowd have seen Molly, which caused a big uproar amongst other artists because they thought that she was promoting the drug. Also, one song lyric even states, "Popped a Molly, I'm sweating, woo." Sweating is only one of the side effects that a person may face when taking this drug. There are both long-term and short-term side effects that go along with taking Molly. There are both psychological and physiological long-term and short-term effects. Some of the psychological short-term effects a person may face when taking Molly is they might feel anxiety, paranoia, depression, irritability, fatigue, impaired attention, focus, and concentration. Some of the physiological short-term effects a person may face when taking Molly is they may feel dizzy, have a loss of appetite, have insomnia, exhaustion, or even aches and pains. Some of the long-term psychological effects a person may face when taking Molly is feeling disoriented, agitated, having hallucinations, or having cognitive or even memory impairment. Some of the long-term physiological effects a person may face when taking Molly is having muscle rigidity, hyper or hypotension, having severe chest pain, having cardiac arrest, having severe hypothermia, renal failure, or even having a loss of consciousness. Due to its euphoric feeling and long-lasting high, Molly is extremely addicting. Dependence happens when the body has adapted to the continued presence of Molly in the system, and it presents withdrawal symptoms once you stop taking it. There are several indicators that a person being addicted to Molly. If a person needs to take Molly in order to continue their normal functioning, if a person is disrupting their life to take Molly, if they are craving the drug, or if they are making excuses or rationalizing why they are using Molly, this person should seek medical attention before addiction gets any worse. Molly addiction treatments are typically 30 to 90 days depending on a person's progress in treatment and their drug addiction history. During this treatment program, a person who is overcoming their addiction to Molly will attend group counseling, individual therapy, and 12-step recovery meetings to learn new coping and life skills to remain drug-free. Overall, a person should stay clear of Molly at all costs because it is a very addicting drug. Since Molly is considered to be pure MDMA, it is more dangerous than ecstasy. It is also a Schedule I controlled substance, which means that it is illegal and that it has a high potential for abuse. Many of the side effects a person can face are painful and dangerous. To avoid getting addicted to Molly, a person should just stay clear of the drug. Always remember that no matter what the drug is, when you put it into your body at risk, and you shouldn't take that chance.